Hi, my name is Kyle Doyle. Today I'll be demonstrating x-ray setups of the toes and the feet. These will be done in an SID of 40 on a 10 by 12 cassette. The patient will be in a seated position, so they'll have shielding over the lap. And the patients will be instructed to take a deep breath in and hold while the x-ray is being taken. So, patient in a seated position, shielding over the lap. Have our marker there on the cassette. So starting with the A to P toes, the toes will be in the middle of the cassette with the central ray directed through the third metatarsal phalangeal joint, and this would be collimated to include the phalanges and the distal metatarsals. Next is the medial oblique toes. The leg will be internally rotated 30 to 45 degrees. The central ray will again be directed through the third metatarsal phalangeal joint, and again will be collimated to include the phalanges and the distal metatarsals. The lateral toe view will be we will use a wooden spatula to separate the toe that we are trying to view. And then the medial surface of the foot will be resting on the x-ray cassette. And our central ray will be directed through the midpoint of the desired toe. Like that. And this will give us a lateral view of the phalanges of the toe, as well as the interphalangeal joints and the metatarsal phalangeal joint. Moving on to the foot, A to P foot. So the plantar surface of the foot will be resting on the cassette. Our central ray will be directed through the midpoint of the foot at the base of the metatarsals. And it will be collimated to include the phalanges, the metatarsals, the cuneiforms, the cuboid, and the navicular. The medial oblique foot, just like the medial oblique toes, will be medially rotating the foot and leg about 45 degrees. Our central ray will again be directed through the midpoint of the foot at the base of the metatarsals, and our collimation will include the phalanges, the metatarsals, the cuneiforms, the cuboid, and the navicular, and this will also give us a clear view of the lateral articulations of the foot. So last we have the lateral view of the foot. So our patient is going to be in a 90-90 setup with the lateral surface of the foot resting on the cassette like this. 70 at 90 degrees. Ankle should be dorsiflexed to 90 degrees. And our central ray will be directed through the midpoint of the foot again at the base of the metatarsals, and then it will be collimated to include the phalanges, the metatarsals, the tarsals, and the phalanges, the tarsals, the metatarsals, and then an inch or two of the tibia and the fibula.